Welcome to the ResQguard training video. Today, you will be learning about a new product from Advanced Circulatory Systems called the ResQguard, which is a device used in the treatment of hypotension from a variety of causes. In this presentation, we'll look at the effects of a ResQguard, an impedance threshold device, or ITD, on a hypotensive patient who is spontaneously breathing, how it compares to traditional therapies for treating hypotension, practical application of the ResQguard, and indications for usage. Recent studies have shown that nearly 20% of all patients admitted to emergency departments are hypotensive. Treatments for these patients have traditionally included fluid therapy, vasopressors, and position changes. While these modalities are effective in treating hypotension, they are not without potential complications. Difficulty establishing an IV, fluid overload, and adverse effects from vasopressors are just a few of the problems faced by caregivers. Until recently, there have been few alternatives. The ResQguard is a safe, non-invasive treatment that utilizes the body's own physiology to help stabilize the hypotensive patient. Let's take a closer look at how it does this. When a hypotensive patient breathes in, the chest wall expands and the diaphragm moves down, creating a slight negative pressure or vacuum that draws air into the lungs. This vacuum is typically around negative 1.5 centimeters of water. During expiration, a positive pressure is created, forcing air out of the lungs. This negative pressure, or small vacuum, draws some blood back to the heart and is referred to as preload, which is circulated forward on the next contraction. This vacuum also lowers intracranial pressure, which enhances perfusion to the brain. However, this small vacuum alone oftentimes does not create enough preload to maintain a normal blood pressure. During inspiration through the ResQguard, the patient breathes in through a slight amount of therapeutic resistance that decreases the intrathoracic pressure, enhancing the vacuum from negative 1.5 to approximately negative 7 centimeters of water. This enhanced vacuum generates greater preload and decreases intracranial pressure even more. As seen on the waveform, this increase in preload raises the patient's blood pressure, resulting in improved blood flow to vital organs. The ResQguard harnesses the relationship between circulation and ventilation to non-invasively help the body help itself. As you've just seen, the ResQguard works much like traditional therapies for treating hypotension, such as position changes, fluid therapy, and vasopressors. However, the ResQguard has definitive advantage over these therapies. Let's take a look at how each of these therapies compare to the ResQguard. First, we'll look at a position change, such as Trendelenburg. Use of the Trendelenburg position has been controversial, in part due to the fact that there is not much clinical data that support its use. While this position may temporarily increase blood pressure, it also raises intracranial pressure. The ResQguard increases blood flow while decreasing intracranial pressure. Often, it is more difficult for the patient to breathe. And finally, there is an increased risk of esophageal reflux and vomiting. Another common treatment for hypotension is fluid therapy. Unfortunately, establishing an IV is not always practical or even possible. In such cases, the ResQguard can be established rapidly, easily, and non-invasively. Where peripheral IV access may be difficult or limited, the ResQguard improves cardiac output and blood pressure. In cases where administering lots of fluids is not ideal, such as in dialysis and trauma patients, the ResQguard may be fluid-sparing and can increase blood pressure with or without fluids. Vasopressors are also often used in the treatment of hypotension. However, when IV access is difficult or impractical, and the infusion of vasopressors gets delayed, the ResQguard offers a rapid, non-invasive alternative. The effects of vasopressors cannot be discontinued quickly when problems arise. The ResQguard offers on-off therapy with the ability to start and stop treatment quickly. Unlike the ResQguard, vasopressors do very little to improve blood flow back to the heart. Vasopressors can cause tachycardia, while the ResQguard has no direct effect on heart rate. And many vasopressors have additional negative effects as well. Now let's look at the distinct advantages the ResQguard has over traditional therapies. It can rapidly increase circulation non-invasively and without fluids or medications. It can be used concurrently with other therapies. The ResQguard is easy to discontinue and does not have delayed side effects. It can be used with a mouthpiece or face mask. The ResQguard is latex-free and is a single patient use device. Now that you have a better understanding of what a ResQguard is and how it works, let's review how to use it. To begin providing ResQguard therapy, first open the package and remove the contents. You will find a ResQguard, face mask, mouthpiece, nose clip, head strap, oxygen tubing, and directions for use. The ResQguard has a patient inspiration port, an expiration port, and a supplemental oxygen port. ResQguard therapy can be administered in one of two ways, either through the face mask or the mouthpiece. To use with a face mask, attach the patient port into the face mask. Inform the patient that it will be slightly harder to breathe through the ResQguard. Instruct the patient to place the face mask on their face and maintain a tight face mask seal. They should breathe normally at a rate of 10 to 16 times per minute and inhale slowly over 2 to 3 seconds per breath. An optional head strap is included to help secure the mask and maintain the tight seal that is important for providing the ResQguard therapy. If the face mask is not tolerated, the ResQguard can be used with a mouthpiece. Simply connect the patient port to the mouthpiece. Have the patient place the mouthpiece in their mouth, maintaining a tight seal with their lips. A nose clip is provided to prevent the patient from breathing in through their nose and bypassing the therapy. Like the face mask, the patient should be instructed that it will be slightly harder to breathe through the ResQguard, and that they should breathe normally at a rate of 10 to 16 times per minute and slowly over 2 to 3 seconds per breath. If supplemental oxygen is desired, connect the oxygen tubing to the oxygen port and deliver 2 to 15 liters per minute. It is important to continue to monitor the patient's vital signs every 5 minutes while using the ResQguard. Once the patient's blood pressure has returned to an acceptable level, the ResQguard should be removed. If the patient's blood pressure falls again, the ResQguard can be reapplied. Like other therapies, use of the ResQguard for a particular age and weight should be directed by the prescribing physician. The ResQguard can be used to treat hypotension from a variety of causes. For example, blood loss, dehydration, heat stroke, dialysis, orthostatic intolerance, and early sepsis. Because the ResQguard can be used in conjunction with more traditional therapies and can be started and stopped quickly, it is an ideal first-line choice of therapy for the treatment of hypotensive patients. You are now prepared to use the ResQguard for your hypotensive patient. If it will be a while before you have such a patient, or you forget what the ResQguard is and how to use it, please refer to the directions for use or quick reference guide packed with the product. Thank you for taking the time to learn about the ResQguard. Please contact us with any questions, and check out our website for more product information and training resources.